abdominal transplant surgeon from the Medical City Fort Worth Transplant Institute in Fort Worth, Texas. The Brandon Holt Show proudly welcomes Dr. Guiteau.
Hey, Brandon, how are you?
Dr. Guiteau, I'm doing fine. How are you, sir?
I'm doing wonderful. Thank you
Welcome.
for having me on.
You're very well. Thank you so much for coming on. Let's just start off. What made you get into the field that you're in as a transplantation surgeon?
Well, if you look at the effects of chronic kidney disease on our population, the population in general, one of the absolute most definitive treatments for end-stage renal disease is transplantation. And looking at transplantation, you have elements of immediate fix in terms of surgery, but then you have long-term follow-up in terms of following up in the clinic for the rest of the life for their kidney transplant. So it really gives me an opportunity to make a really big impact up front, but then also to see that bear out over the course of the patient's life.
So what's most rewarding about what you do?
You know, I think when we go to the operating room, a lot of people have a lot of anxiety, family members especially, but they've been waiting 3, 4, 6 years to get transplanted. And so the most rewarding thing is when I'm able to get them to go to sleep, perform a successful operation, and have them wake up with a new lease on life.
Dr. Guiteau, what is that process like when you're actually taking the organ out and taking the organ to the person who's receiving the transplant? Kind of paint the picture of what do you do right in the middle of the emergency or in the operating room?
Oh, I think that's a really good question. I think when you think about transplant surgery, or at least kidney transplant surgery, we do not remove the organs of the recipient. So if you're getting a kidney transplant, you will end up with 3 kidneys. And if you get another kidney transplant, you will end up having 4 kidneys. And so when I receive an organ that's usually either shipped or flown in from wherever their donor is, I take that organ, I take a look at it before bringing in the patient into the operating room to make sure that it's a quality organ. And then after I've verified that the organ is what is going to be what we expect, then we bring the patient into the operating room and start performing surgery.
So what I hear you saying is that when someone receives a kidney transplant, they now have 3 kidneys inside of them?
Right. I don't even see their kidneys that they're born with.
Okay, got it. So when we think about chronic kidney disease, what are some factors that lead to that? Is it a lifestyle? Is it food intake? Is it lack of exercise? I hear when people take a certain amount of medication for a long, length of time throughout their life, it can affect their kidneys. What are some causes for chronic kidney disease?
And that, those are really good questions. If you look across the United States, the number one reason people develop chronic kidney disease is diabetes. And the number 2 reason people develop chronic kidney disease is high blood pressure. But as we know, developing diabetes or even high blood pressure is a combination of all the things you mentioned. It's a combination of lifestyle, exercise, food choices. And there are also medications that can affect your kidneys as well. So you may have multiple factors that affect kidney health and may end up leading to chronic kidney disease.
Okay, so is there a certain population that chronic kidney disease affects the most, whether it's the African American culture, the Caucasian culture? What culture seems to be impacted the most from your experience?
I think when you look at sheer numbers, looking at the way the population is set up, that most of my patients are Caucasian. But when you look at the percentage of patients that are affected by chronic kidney disease, African Americans are disproportionately affected by chronic kidney disease based on the number of African Americans are in the United States.
Okay, go ahead.
And so if you look at, we are 5 times more likely to be diabetic than the general population. When you look at people with diabetes or who are obese or have high blood pressure within our population, we are more likely to develop end-stage renal disease than the general population. And so if you're looking at numbers, more Caucasian than African American or Hispanic. But if you look at percentage of patients that have disease processes that go on to chronic kidney disease, we are disproportionately affected.
And now you don't just operate on kidney, transplantation. What are some of the other organs that you operate on when you're doing a transplant?
We also at Medical City do pancreas transplants. And that is all of the abdominal organs we do at Medical City Fort Worth, but over at Medical City Dallas, they're going to be doing livers. They also do heart transplants as well. So within the Medical City hospital system, we're transplanting hearts, soon to be livers, kidneys, and pancreas.
Now, is there a criteria that someone has to meet? Is it one set of criteria, or is it multiple sets?
Well, for kidney in particular, we basically say you have to have end-stage renal disease. So that's either means you are on dialysis, or you have what we call a GFR. It's a measure of how well your kidneys are filtering of less than 20%.
Now, what exactly is dialysis for our viewers who are watching? Because we know what the term is, but what exactly is dialysis? It's a two-part question. And does someone have to continue to take dialysis in the near term once the transplant has taken place?
Both are good questions. Dialysis is a man-made method of performing one of the many functions that the kidney does. One of the most important functions of the kidney is that it helps to filter our blood. And so it deals with things like potassium levels and electrolyte levels and acid levels in our blood. And so when your kidneys fail, your body no longer is able to regulate those electrolytes. And your body, if you have too much of certain electrolytes, they can affect your heart and lead to things like cardiac arrest. And so dialysis is a way of using a machine where we then filter out those electrolytes so that they don't reach dangerous levels.
Okay.
It also
go ahead, Doc.
I would say it also helps to regulate how much fluid we have on board as well. So if your kidneys aren't working, you tend to swell up. And so we also can take off fluid through dialysis as well.
Now, can you drink too much water, or can you drink not enough water?
Well, you can drink too much water if you drink it very quickly over a short period of time, but your kidneys do a very good job of regulating water. So if you drink water throughout the day, then your functioning kidneys should be able to handle that.
So, doctor, if someone is on the kidney transplant list or any particular organ, two parts. What's the longest they can stay on that list before their body's going to shut down all the way? That's part one. And part two, is there a long waiting list, or can you have a direct access to the transplant?
So also really good questions. When you look at and we'll focus on kidney, but if you look at the kidney transplant wait list, there are about 100,000 people in the United States on the wait list right now.
You said how many, Doc?
100,000, about.
100,000, okay.
And we do about 25,000 transplants a year. So that leaves us with 75,000 people a year who are waiting for kidneys that don't get kidneys.
And is there an age limit?
There is not an age limit, but what I do say is as you get older, you do not get healthier. So if you're looking to get transplanted, the younger you are, the more likely you are to be healthy enough to undergo transplant. But I have transplanted people in their mid to upper 70s while at Medical City. And so there is no age limit. It's more about physiologic age than it is about actual age.
Doc, what is the anti-rejection medication that patients have to take for the rest of their life? Why do they have to take that medication, and what exactly is it?
The most commonly used anti-rejection medication is tacrolimus, but we also use two other medications alongside. We use prednisone, which is a steroid, as well as Myfortic or Cellcept. And the reason why we have to take that medication for the rest of the life of the kidney is because our bodies have been engineered to fight anything that you haven't been born with. Mm-hmm. So if you put in a kidney transplant, your body is going to recognize that as foreign material and it's going to try to destroy it. And if you miss even one dose of that medication, it gives your body an opportunity to start to perform its job, which is to fight off that kidney and reject it.
So is there a touch and go period post surgery where you have to really watch the patient, or do you know after the surgery has taken place that okay, this person is going to be okay, they're going to make it?
That's a good question. Immediately after surgery, you get very, very strong doses of anti-rejection medications. And those medications get put in through your IV. The most common one we use is called thymoglobulin. It's very, very strong. Its effects last up to 6 months after we give you the medication.
Mm.
So while we are getting those other medications up to the levels that we need, you have that medication that's already been given to you that lasts a really long time.
And if someone has the surgery and it's successful and their new kidney rejects, is there another transplant that can take place to put another kidney in?
Yes, I think the first thing to realize about rejection is that rejection doesn't necessarily mean that the kidney stops working. So rejection is a period of time when your body is fighting the kidney, and we actually can treat rejection so that we can prolong the life of that kidney itself.
Mm.
And even if your body rejects the kidney to the point where that kidney stops working, we can give you another transplant in another location.
Wow, that's powerful, Doc. Doc, what are the keys to success?
For transplant or in general?
Just in life. How would you define the keys to
I
success? You
I
name
think
it.
I think that there is a tremendous amount of self-reflection that needs to be done in terms of looking at how you want to um, to have people see you. And then I think there's a tremendous amount of focus that goes into achieving your goals. And then there's also humility. I think humility will take you a long way in that knowing that there are limitations to what we're able to do. Don't let those hold you back to try to do things. But I do think that you have to take a look at the blessings that you have and really be thankful for those, because that will really really make you appreciate what you're able to accomplish.
Ladies and gentlemen, abdominal transplant surgeon from the Medical City Institute in Fort Worth, Texas. Thank you, Dr. Guiteau, for coming on. He'll be back in just a few minutes. But up next, you do not want to miss this. We have a young lady who received a kidney transplant last year, and she's here to tell her story and what she's doing post transplant.